More and more people are suffering from Alzheimer's disease and related dementias, short ADRD. New research directly links sleep deficits to ADRD. And we are also finding that people living with ADRD frequently suffer from sleep deficits. To discuss this and more, I have with me Professor Marina Figueiro. She is director of the Light and Health Research Center for the Icahn School of Medicine at Mount Sinai. Professor Figueiro, it's great to have you here. Thank you so much for taking the time.
Thanks for having me. It's a pleasure.
Professor, why is good sleep so important for protecting the brain?
Well, there's a lot of work already being done looking at the benefits of good sleep. We know that we consolidate our memories when we're sleeping. We learn when we're sleeping. And related to the topic, Alzheimer's disease, it seems like sleep helps clean up the brain, basically. And that reduces the accumulation of plaques, which are really the hallmark of the disease, of Alzheimer's disease. Other than that, it's really, everybody knows the benefit of a good night's sleep. You wake up refreshed the following day, you're more productive, you're happier, you're more alert. So there are immense benefits of good sleep.
Light therapy is showing great promise for regulating the sleep-wake cycle. Can you tell us a bit more about how light therapy works and its benefits?
Yeah, so let me start with a little bit of the basics. So we all have a biological clock in the brain, and that biological clock regulates our circadian rhythms. And our circadian rhythms are every rhythm in our body that repeats at approximately every 24 hours. So for example, the sleep-wake cycle, it's a great example of circadian rhythms. We're supposed to be asleep at night, awake during the day, and that's supposed to happen every day. Now, if we are in a dark cave, those circadian rhythms in humans are going to run with a period slightly longer than 24 hours. On average, about 24.2 hours. So what happens is every day you would be about 10 or 15 minutes out of sync with your watch. Obviously, if you're in a dark cave, it doesn't matter because you don't really have a fixed schedule. You don't have an alarm clock, so it won't make any difference. But if you're in normal social environments, you have alarm clocks, you have obligations, you have to wake up at certain times. So you really want your biological clock to be in sync with your external watch. And that's what light does. By getting up every morning, exposing yourself to a certain amount of light, you are entraining your biological clock so that it runs with 24 rather than 24.2 hours. So what's the advantage of that? Now, when it's time for me to fall asleep, my biological clock will tell me it's time to go to sleep, and it coincides with the clock that I want it to go to sleep. Other than I lay down in bed and I'm like, ooh, 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 and I can't fall asleep because my clock is not telling me to fall asleep, even though my watch is saying, it's midnight, you got to fall asleep because you got to get up tomorrow. So what light does, it maintains that regularity and it maintains that synchronization between your internal clock and your external biological clock. I'm sorry, your internal clock and your external watch or hour.
Population studies show 20 to 24% of persons with ADRD suffer from depression. The numbers could well be higher, and antidepressants have shown to have had limited impact with numerous side effects. And for those in care homes, the COVID-19 pandemic has probably actually exacerbated the situation. So how can light therapy bring improvements for those ADRD patients suffering from depression? And why is this form of therapy not applied more widely in care homes?
That's a very good question. So we do know from the science that there is a circadian rhythm component into depression. Okay, so if you think that people that are disrupted or have this out of sync circadian rhythm, they're also going to have bad sleep, and all of that compound can make depression worse. So what we have seen with Alzheimer's patients, it's actually incredible, the results that we have found. So what we showed is by giving them a very robust light-dark pattern. And I do want to point out that it's not just about the light that you get during the day, but it's also about getting darkness at night. So it really is this light and dark daily, continuously, always at the same time, that is important for the body. So what we've shown is by giving the Alzheimer's patients that very continuous light and dark, that they first of all, improved sleep, they reduced depression, and they reduced agitation. But the results on sleep, I have to confess, I was expecting it because that's what you would expect. I just explained why. But on the depression part, it was actually surprising to me because it was a very strong effect. And we were like, well, it sort of makes sense because you're sleeping better, you're training your circadian rhythms. So it makes sense that you are seeing that benefit on depression. But to your point, it's not used or it's not even known as much as it should. We do know in terms of light therapy that it's a recognized treatment for seasonal depression, right? So SAD or winter blues, when the days are getting shorter, people tend to get depression, which is a different type of depression than the major depression, but still very common. And light therapy is very well accepted in the clinical community as a therapy for reducing seasonal depression. It's very interesting. The mechanisms are still under debate, but one of the hypotheses is that because you have later daylight or later dawn in the morning with winter months, you don't get that morning light that you need to maintain that circadian synchronization. So then you lose that. By losing that, you affect sleep, and some people get affected in the brain, and it turns out that it ends up being seasonal depression. So it is very well recognized for the seasonal depression part, but not as much for the major depression. There are a few studies on that. Again, we showed very robust on Alzheimer's patients, but I think it's really lack of more studies showing the efficacy and the benefits. Now, I do want to say too, is one thing very interesting about lighting, which we are trying to help and fix, is the fact that people don't know how to specify the light. People don't know what kind of light they need to use. And if you're only using those big, bright light boxes, it may not be comfortable. People may not like it. So what are the ways that you can deliver that light so that it's effective and yet it's comfortable and people can comply with? And I think that has been our success. So I have a feeling that if people start using and implementing better lighting solutions, that you're going to see more positive results in the literature, and then you're going to see more common use of light therapy for helping with depression.
But what further questions are still to be answered when it comes to improving quality of life for those with ADHD and suffering from depression? Understanding the mechanisms. I think we still don't know the mechanisms and how is it that light actually affects the brain. We're starting to learn a little bit more, and I think there's going to be more work being done in the future is on how is it that the eye respond to that light to affect the biological clock and even to affect depression. So for example, there has been a line of study where they're seeing a direct connection between the photoreceptor in the eye that responds to light to the amygdala, which is associated with depression. So it may be that there's actually a direct connection between the outside to parts of the brains that control depression, or at least that are linked and have been related to depression.
So I think that understanding those pathways and those mechanisms are things that we still need to do. The way we approach the problem is we almost like we started on a reverse way. So we started in the field, applying the light, giving the right stimulus, and measuring the impact of it. And it's interesting because you mentioned the COVID-19 pandemic and how it made it worse. Well, we did a survey during the lockdown in March 2020, and we had over 700 respondents. And we asked them very, very simple questions like, how bright is the space that you're working in? And how long do you spend outdoors during the daytime? And it was a beautiful correlation. The darker the space, the more depressed, more anxiety, and worse sleep that they were reporting having. As they got brighter and brighter, you see that effect reducing. So in other words, they improved depression, they improved anxiety, they improved their sleep disturbances. Same thing with going outdoors. If they were spending 10 minutes outdoors, you see that they would have more depression, more anxiety than if they were spending 1 to 2 hours outdoors. So, I mean, clearly, the more light you get during the day, you are benefiting your sleep and you are benefiting the depression. I think understanding the pathways, it's where we're going to start working backwards now and trying to define what those pathways are.
Professor Figueiro, thank you so much again for taking the time. I know now why I need to snooze always 10 to 15 minutes in the morning, and hope to see you again soon. Thank you.
Thank you very much.